for this Facebook Live on concussion awareness and prevention. School's back in session, and fall is also a busy time with activities, sports, travel athletics, all of which can pose a risk for concussions among kids and teens. I'm Kate Marino with the Children's Hospital of Richmond at VCU marketing team, and I'm joined by Dr. Katherine Dec, who specializes in sports medicine and concussion, a type of traumatic brain injury. Dr. Dec is co-director of the new Pediatric Traumatic Brain Injury Program as part of our Neurosciences Center, and she's going to answer some of our questions about concussion based on the latest research and practice. If you have any specific questions along the way, please leave them in the comments and we'll try to get them answered live during this video or online throughout the next week. Dr. Dec, can you lay the groundwork for us by starting out explaining what is a concussion exactly and where does it fall on the spectrum of traumatic brain injury?
Great question. I think it's still confusing even though we've had traumatic brain injury around for a long time. So traumatic brain injury has different grades. We call mild, moderate, severe. Concussion's usually in that mild range that you don't necessarily lose consciousness. You just have symptoms that occur. So it's in that very beginning, early stage of what we think of as a brain injury. But it is a brain injury. It's not just what we used to say in the days when I was an athlete, you got dazed. It truly is an injury to the brain. So on the mild end.
Okay. Thinking about concussions, a lot of times we think about headaches, dizziness, those are some of the symptoms, but what are some other symptoms parents need to be aware of and look for?
So this is where I think a lot of information is expanding. We see there's several different categories of things that can happen in the brain, but think about it, the brain is a very unique and complex organ, and we're learning more about it. So one of the things with the brain is it affects sleep. It can affect appetite. It can affect your eye movement, your ability to take information in through your ears and your eyes. So processing of ocular or reading or cognitive, as we call it, your thinking ability, your ability to take information in quickly, your ability to take information, store it, keep it in memory, and then pull it out again when you're a student. So we have cognitive aspects. We have the physical aspects, so sometimes your heart rate and your autonomic, as we call it, the effects in the brain and how things recover when you're training, or just physiological pieces of the brain that regulate the rest of the body. And then your physical, your motor ability that we think of, your balance, your vestibular, your movements, your ability to have feeling normal, emotion, mood. Sometimes folks with concussion will have mood changes or be more irritable. Or I can remember an athlete that was just laughing uncontrollably after their concussion and thought that that was strange. So your emotions can shift, your moods can shift, not just the headaches, not just the dizziness.
Okay, interesting. You talked a little bit about sleeping and sleep changes. I know that I've heard a child or a person shouldn't sleep after a concussion, or maybe they want to sleep more. What do we need to think about in terms of sleep when it comes to concussion?
That's a good point. I think a lot of people still think that people need to be rested in a dark room. So no, we don't need to completely close them from all sensory information and be sleeping and make sure they get awakened all through the night to see if they're okay. We like kids, if it's like a Friday night game or a Tuesday night game, to go home, be assessed by the person at the facility that they're at, see their parents monitor them, but let them go to sleep. You don't need to wake them up all through the night. One of the things with sleep, though, is we're seeing more and more that there's problems with sleep. After the concussion and the way the brain gets shook in the head, you can have those nerve signals that go back and forth that help regulate your sleep, make you feel that you're not as sleepy as you usually are, or you can't fall asleep as quickly, or once you fall asleep, you just can't stay asleep. You keep waking up. So we actually know that with concussion, as with traumatic brain injury and brain injuries, you can have problems with sleep that's related to your concussion. So when we think of strategies, we really want to understand as specialists when we assess the person that has a concussion, what can we do to help them with sleep? What is their prior pattern of sleeping? And I have teenagers, so I I know a lot of people stay up late on their phone, and a lot of my patients tell me they're texting and talking to friends until 2 or 3 a.m. and how can I possibly know what their normal sleep cycle is like? So sometimes the strategies we use as professionals is we try and find how your sleep pattern is, and we may use apps that are on the cell phone where we try and find ways to not get them to wake up at a certain time, but to sleep through their whole sleep cycle, so they reach the whole phases of sleep. So I think some of the sleep things that we're looking at in concussion now are really strategizing with the different ages of folks that have concussion and brain injury. How do we help them get good sleep? Because without good sleep, we don't recover well. That's part of our resting time. So I think that sleep is a problem, and it's a problem I think we're looking at better, but we're still just in the beginning stages of great research on exactly how to help with that sleep problem.
Okay. And you touched on screen time. Screen time is a big issue with kids and teens for many reasons, but can it affect concussion recovery, and how?
It can. Let me go back to the problem with your visual. When you're tracking on a screen, there's pixels, whether it's a movie screen, the computer screen, watching a video in class, or working on your Chromebook, which a lot of our kids use now in school. There's also this light that happens, so the blue light effect on the eyes and the brain. There's a lot of pieces to the neurotransmitter system and how the brain responds to those things. And we do find that folks that have visual ocular motor issues or having problems with the intensity or the fatigue of the eyes using screen time, and that includes the cell phone, issues with trying to get them better, we tend to restrict that. And it is hard, I agree. We've had a lot of strategies in working with some of our teenagers in reducing the screen time, wearing our, we call them gamer glasses or blue blocker types of glasses when you have to be on the computer, or our college kids that have to be on the computer for something that's due. Those types of things we work with the patient. There's not really a set thing that everyone has to do. It's based on what their symptoms are.
Okay.
But it can make them worse if they continue to try and push it.
Okay. So maybe the texting and the late night, social media scrolling could be eliminated.
Yeah, that's a sleep
scaled back.
and a technology issue.
Okay. Sports, we've talked about, a lot of these concussions occur during athletic activities. Is there a certain number of concussions after which you would recommend disqualification from sports?
That's not well defined in the literature.
Okay.
So that is a question as a sports medicine physician I get asked a lot, and so do my colleagues, because there's different literature out there about 3, 4, 6, 10 concussions. But I've had athletes individually respond well and recover well and have more than 3 concussions and still be able to go back to soccer. Now, the timing of the concussion and if their symptoms have recovered does make a difference. So the more concussions you have, the longer it can take to recover. And you shouldn't go back to play when you're in the middle of recovering. So I think that when they ask, I've had 3 concussions, I'm done, that is not the answer. We have not proven there's a number. One person with 1 concussion could be pretty severe, and it may be a good idea they don't continue. They may not recover from those symptoms. But then someone else may have 6 or 7 concussions through their 2 or 3 years, 4 years, 10 years, and they recover fine after every concussion. So they aren't disqualified based on their number of concussion. We assess them individually.
Okay. How about exercise? Maybe not on the field, but exercise and other activities. What do you recommend post-concussion or during recovery?
I love that question because the sports med docs would like people to be active.
Right.
So one of the things that we look at in the other literature with mental health, which we've talked about before at CHoR, is the issues of exercise and helping with recovery. Heart conditions, getting our blood sugars regulated, helping with mental health. Well, we know also it's the brain, and exercise helps the brain recover. There's physiological responses. The thing we don't know is what exercise, how much exercise. We don't want the exercise to continue to push their symptoms. We want the exercise to be safe. We call it sub-threshold. So sometimes we'll look at aerobic as the only option, and that aerobic may be an activity that's aerobic, but we don't return to sport before their symptoms clear. So in the state, in Virginia, we do have a rule. If you're in doubt, sit them out. We want to make sure that if they're suspected of having a concussion, they don't return to the game or play that day But it may be that they have no symptoms by day 3, or they're starting to feel better, and the child likes to go for a walk with the dog. So there's activities that we can do to keep them exercising, but we do decide individually. Maybe in the future we can think of some specifics, but right now we're looking at what exercise can they do to stay active to help the brain recover without pushing their symptoms.
Okay. How about prevention? What can we do as parents, as professionals, to help prevent concussions in the first place?
That's a loaded question. So, to minimize the risk of getting a concussion, I think the big factors are we need to know what concussion is. So the education is important. It's interesting, a survey has been done recently with all the information out there. There are still misconceptions in adults, in the athletes, and certainly in the kids, in understanding what a concussion is. So they're watching out for their teammate, or their parent is watching out for their child. There's also a fear with it because they've heard all these severe things that can happen. So I think minimization of risk versus prevention. So
Okay.
decreasing the concussion, don't put them back to play if you suspect they have a concussion. That prevents those prolonged concussions or more problematic recovery issues. I think also following the rules. So if mom and dad say it's okay to go out and ride a bike, don't take the helmet off and throw it to the side. You should ride it with a helmet. We know that that is a safety thing. So some of the things that we naturally do for safety in the rules of sport, we should follow the rules of the sport. And I think doing that makes a big difference. I think the other thing I find with concussion risk is that if we are looking at some particular mouth guard or helmet or physical exercise to say this prevents concussion, that has not been proven.
Okay.
Helmets are made to protect a cracked head, a fracture, an injury to the head. They're not going to slow the movement of the brain inside the head.
Good. I've never really thought about that as a parent. That's very important to bring up. Let's talk about concussion care. What are some things parents can look for as we're trying to find the best care for our child after a concussion?
I think it's good to see a professional quickly.
Okay.
I think that it's great that parents are educated and they know what to do, but we found that the sooner these concussions, even though they seem mild, can get into a specialist and start the treatment that needs to happen, or the rest, or the changes in their school environment that helps them so they don't stress about testing, etc. That makes a big difference. So getting into someone quickly. What's really nice is we have this new program, as you mentioned at the beginning, at Children's Hospital of Richmond, and the extenuating age group through age 21. And it's a very intense program because we take from the more severe, the PICU, we have directors there that translate that care, empower the brain to recovery, seamlessly move to the outpatient environment, and continue to have care in the outpatient environment. But then concussion, they can come in very quickly. We've been getting people in the same day on some concussions where they can actually come in, see the physician, and start their care with the allied health professional and a team of people that will help them for their individual problem and answer a lot of the questions that they have. Help them understand things they can do at home to try and keep their symptoms down to help with their recovery. So I think that if you go to our website, the number that we have on there is both toll-free and direct through 804, but that will get you to a very qualified concussion nurse navigator. She can answer your questions, also direct your care to the person that they need to see. I think that there's also the specialist side that we have here at the VCU CHoR system, where we overlap with the VCU campus, because medicine's an art, and that interaction on the social side is also as important as the medical recovery. So there's a lot of collaboration between all the specialists in this neuroscience center and in the bigger university as a whole to help young people, to help kids, to help with that return to school and return to sport.
Great. Well, you comprehensively answered my next two questions, which were about the program and how we're improving access and care for pediatric concussions. And then also how to get to you and your colleagues who can help these kids and teens who are sustaining concussions, which is through that chrichmond.org, and you can look for the concussion program, and Nurse Navigator can help walk parents through, because I know it can be a little overwhelming when you're not sure where to start. So the really nice thing is that nurse is there to help parents step by step through the process. So anything you think we've missed or that we should add on the topic?
I'm biased. I think our program is extremely strong. I've worked in this field for over 25 years, so I have a familiarity with being on the sideline and being in the clinic, and I really like how our team has come together and how the access is so quick, even in a big academic university center. So I like how this new program for TBI and concussion has been able to help patients at the front end very quickly get care and get to the right person at the right time. So those are the big things I just want to make sure I emphasize, and to please check the toll-free number and the 804 number online so you can reach directly to that nurse navigator. Thank you.
Great. Thank you, Dr. Dec, and thanks for joining us.